thanks everyone for taking the time to join us today. We'll get started from the Legislative Building in Regina. We have Health Minister Paul Merriman, Saskatchewan's Chief Medical Health Officer Dr. Shahab. As well, on the phone lines, we have SHA CEO Scott Livingstone. We'll start with remarks, Minister Merriman.
Good afternoon, and thank you for joining us here today. Today, I want to provide an update on the progress of the vaccination process. Vaccines are proceeding quickly as possible in Saskatchewan, given the limited number of vaccines that we have received to date. In Regina, we have now completed all of the first doses from the initial shipment of Pfizer vaccine that we have received. We've received 3,900 doses in our first shipment to Regina, enough for 1,950 first and second shots. We are currently able to complete more than 100% of the first shots. That's because by carefully measuring and administering the exact dosage in each shot, our healthcare workers were actually able to do 2,069 first doses. We have already begun administering the second dose to those same 2,069 healthcare workers, at which point they will be fully immunized. In Saskatoon, we received 4,875 doses, enough for 2,437 first and second shots. We have now completed about 98% of the first shots in Saskatoon. The first shots should be completed by tomorrow morning. And those same healthcare workers will then begin receiving their second shots next week, at which time they will be fully immunized. For these first two batches of Pfizer that were sent to Saskatoon and Regina, the manufacturer and the Public Health Agency of Canada required us to hold back the second shots. Going forward, we will no longer be doing that. We will be administering the vaccines as soon as we receive them. We also received our first batch of Moderna vaccines in Saskatchewan just last week. Yesterday, we began administering those vaccines in northern Saskatchewan to healthcare workers and long-term care residents. We are continuing to deliver these vaccines to the three far north regions as well as the northeast region. In the northeast, vaccines will be sent to Melfort. The priority groups will be the same, ensuring that frontline healthcare workers, residents, and staff of long-term care and personal care homes receive immunization first. And I'm glad to announce that 3,900 Pfizer vaccines have arrived today in Prince Albert. This is great news for them and their community. They have arrived at the Victoria Hospital today. And given to priority healthcare workers in emergency rooms, intensive care units, COVID-19 wards, and testing assessment sites, as well as all residents and staff in long-term care homes. So here in Saskatchewan, we are getting the vaccine into people's arms as quickly, safely, and effectively as possible. But we are limited by the number of doses that we have received. We could get absolutely more vaccinations done more quickly if and when the federal government provides us with more doses. As of right now, the federal government is telling us to expect about 6,800 Pfizer doses a week in the last 3 weeks in January, and one more shipment of 5,300 Moderna doses. That's a total of 30,000 doses expected in January. This is just simply not near enough. And it is significantly less than they promised us just last month. We continue to raise our concerns about a slow pace of vaccine deliveries with the federal government at the officials level and at the ministers level. Tomorrow, Premier Moe will be on a call with the other premiers and the Prime Minister, and I know he will be raising this issue on that call. We are ready to deliver the vaccines to Saskatchewan residents as quickly as we receive them from the federal government, but again, we need more vaccines. Once again, I would like to thank everyone in Saskatchewan for following all of the public health guidelines over the holiday season, and ask everyone to continue to follow those guidelines. As you know, the current set of public health orders are in place until January 15th, which will be the end of next week. So early next week, we will be determining whether those orders will be extended or changed. We will have more to say about that next week. With that, I'll ask Dr. Shahab to make a few comments.
Thank you, Minister. So, first of all, I'd like to start by offering my condolences to the residents who have passed away since our last media avail. So, since December 31st, a further 20 Saskatchewan residents have unfortunately passed away. And so, our thoughts with their friends, family, and communities at this time. I hear further to Christmas, we had, mild weather over the new year, and many families were out and about, and for the most part, people stayed to their households. So again, recognizing the steps everyone took to make sure that we don't see a surge after the holidays. And we are monitoring the trends very closely. We, did see a bit of a dip in our numbers as well as lower testing rates. Our numbers are now back to that around 200, 233 daily new cases, 7-year average. Daily case rate went down to less than 15. Now it's back around 19. Test positive remains high at 11%. So again, I think we need to remain cautious as we were before, during the holidays, before the holidays, during the holidays, and now coming out of the holidays in 2021. Of course, schools have started either in person or remote learning for a week or two in some school divisions, and for the most part, everyone will be in school in person middle of January. So again, all the good practices that kept school numbers low, where they just reflected community transmission, will be important going forwards. People going back to work, either working from home where possible, but also observing all the cautions that we should observe at work or at play or when out shopping, I think is going to be really important going into January. We have unfortunately seen a few transmission events where people did get together over the holidays, even in situations where someone living alone got together with another household member, a household like the parents. No one intends for transmission to happen, but again, the fact that we are seeing transmission events does show why those guidelines are so important over the holidays, and otherwise we would have seen a significant spike, and we are still watching closely for that. Like the minister said, vaccines are being distributed and being administered as they arrive. And it is a very limited supply for the time being, and of course it's a very complex logistics in terms of handling the vaccines. -70 for Pfizer initially, and then redistribution under very strict guidelines, and similarly for Moderna at -20. And for the most part, the vaccination program is running smoothly. Obviously, the Saskatchewan Health Authority partners, First Nation partners, other partners are working in a very collaborative way to make sure that vaccines, as soon as they arrive, they are administered into the priority groups, which at this time are long-term care residents and staff, and COVID-facing healthcare staff. So again, it's a complex vaccination program. The numbers will start increasing March, April, and more groups will become eligible by age and by comorbidities. But at this point, there's very limited supply coming at fixed intervals in January and February, and being administered as soon as it arrives, and is, has distribution done secondarily to the points from where it's going to be administered. So with this, I think I'll just stop and just re-emphasize that I think we've done really well collectively over the holidays, and now that we go back to school or work, we need to keep focusing on those measures, those everyday measures that may not have brought our numbers down significantly, except over the holidays, but there were different reasons for that. But certainly that we really want to keep our numbers certainly not going above what they are currently, but also hopefully trending downwards over the next few weeks. Thank you.
All right, thank you, Minister. Thank you, Doctor. We'll start with a question in the room. Lynn?
Minister Merriman, you said that vaccines are going out as quickly as possible, and I understand that Saskatchewan has received more than 13,000 doses to date, or as of December 31st. And yet yesterday, I think only 270 were administered according to the numbers we got. So like, what's the holdup? Why are things still rolling out so slowly, in a sense?
Yeah, I understand the 13,000, because yesterday we have administered, first of all, we had to hold back half, as I identified in my opening comments. That was dictated by the federal government and by Health Canada, that we had to hold back that second dose, and we won't be doing that any longer. The doses that have arrived in Saskatoon and Regina are out. As I identified, we actually had extra doses in Regina, that 1950 individuals that were getting. We were actually at 106%, just because we were able to pull some more of the vaccine out of the vial. Now, in saying that, the ones that we had after that, the shipment has gone up north. Now, obviously, in northern Saskatchewan, there is logistical challenges up there. This isn't where we can do 5,000 or 1,000 people over a short amount of time. We have traveling that they have to do. We have our clinics up there and ready to go. So it is going to go slower in the north, and that's specifically why we had the Moderna vaccine shipped up to the north, and that was our first shipment of Moderna went to northern Saskatchewan for those specific reasons. It was easier managed from our healthcare workers, and we had more time to be able to administrate that out. So a snapshot in time is it looked like we had less yesterday, but we're actually at over 100% here in Regina, and 100% of the vaccines have also been the first dose in Saskatoon. So we're getting them out as fast as we can.
Follow up, Lynn?
Yeah, what changed that the federal government is no longer requiring you to hold back that second dose? And then now that you're administering them all right away, are you prepared to do that quickly as we get more doses with, like you said, all these logistical challenges?
I'll get Dr. Shahab to answer on the criteria of what the change was between the first and second dose.
Yeah, so, early December, we thought vaccine would come, late December, early January. Then there's this opportunity middle of December to receive some vaccine early. Initially, there was a dry run. So vaccine didn't come, but there was a dry run of transporting, in case of Pfizer, that's the vaccine received mid-December, minus 70. Once that was successful, the actual vaccine came, and the logistics of receiving, storing at minus 70, administering, and then working out the logistics of distribution were worked out. So at that time, absolutely the requirement was you hold the second dose, because the second dose actually is being given right this week. So the first dose that was given in middle of December and January, the second dose are given right this week. So again, there's a 3-week interval. So that is the plan for the first shipment and the requirement to hold back the second dose. Now, like the minister said, we have a set allocation and delivery sequence by week for Pfizer and bi-weekly for Moderna. So now that we know that, okay, we're getting a set amount every week for Pfizer, every 2 weeks for Moderna, we don't have to hold back the second dose. We can send all the doses out, fan them out. And again, the fanning out is logistically very complicated. These are not your influenza vaccine, which is fridge stable. These are initially minus 70 Pfizer, minus 20 Moderna, and even redistribution has very strict criteria. So it is being distributed. And then the administration, it's not like, when you do a flu clinic, you can do thousands of people a day because it's a big flu clinic. Here, the distribution is going to very specific locations, primary care homes, long-term care facilities, staff in those facilities, and specific staff who provide care for COVID patients. So again, it's small amounts of people across huge geographies. So I think that's the other logistics, that you have to receive, you have to transport under very strict criteria, and then you have to administer to very specific individuals in those locations.
Okay, sorry, just to clarify, so those second doses that were being held back, that
they are being given this week. They are being administered this week of Pfizer. So I just want to clarify again, in December, the allocation over January, February had not been finalized. So that is a pilot in Regina. And because the allocations were not finalized, half the doses were held back because that was the requirement of the pilot, that you hold back half the doses. And those half doses actually are being administered this week. So all the doses from the vaccine would be completed this week. But the future doses that are coming, not just to Regina, Saskatchewan, but now PA and other points over the next few weeks, because we already know now, January and February, that we are getting weekly allocations for Pfizer. We no longer have to hold half of the doses back. And similarly, and for Moderna, we're getting bi-weekly. But even when you say that in small geographical locations, you have to see, is it better to send 30 doses now, another 30 3 weeks from now, or send 60 where you can have 30 remaining? For Moderna, you can do that because you can hold them at fridge temperature for 29 days. Pfizer, you can only hold at a fridge temperature for 5 days. So you may have to send 30 again after 3 weeks. So the logistics are very complex. The ultra low temperature freezers are not everywhere. They're in 4 locations right now. But the logistics are extremely complex, and that's why it's a dynamic situation. Where is the second dose held? Either it's not held, you take it from the next shipment, or it's held at a hub with an ultra low temperature freezer. But the point of administration, you only send as much as needed for the initial administration, and then you replenish that. And right now there's 3, now possibly 5 hubs with ultra low temperature freezers. As those hubs expand, again, the logistical piece is extremely complicated and is being managed with great thought to make sure that we minimize wastage, but and distribute in a way that vaccine is there when you need it in the thawed state.
Yeah, and maybe just add to that, there was 2 separate processes. There was our pilot, as Dr. Shahab just said, our pilot program where we had to keep the second dose. We had to keep those. What we're working on now with Moderna and the new shipment of Pfizer is a new program that is only the 1 dose goes out, and then we have a sequence. When we got the pilot dosage, we didn't know what our schedule was going to be like. We had no confirmation of what was coming, so we had to save that second dose. Now we've have, even though they are reduced numbers, we're getting fairly consistent information from the federal government that we're getting around 6,800 each week. So we can do the first dose now, and then when week 4 comes, we've got that 6,800 to be able to do second dose on those individuals. So they're 2 separate things. The pilot is a pilot, and that's why it was there, to be able to test the system. And we've got, as I mentioned, those pilot ones are out. First dose is all gone. Second dose starts right away. So we had to wait that amount of time for that. So 2 separate things that we're working on, and now we're basically going first dose. If we get a dose in Saskatchewan, it's going out and going to be somebody's first dose.
I just want to also say that, when we do the flu program, we comfortably deliver 80,000 doses a week. So the capacity is there well beyond what's required for the COVID vaccine. And, come April, March, once we see high volumes of COVID vaccine coming, hopefully that will be the process, that there are immunizers in Saskatchewan who can deliver comfortably 80,000 doses a week. So it's not, but right now with limited amounts, and the fact they have to go to specific individuals who are long-term care residents, for example, in specific communities, and the logistics are very complex. So, it is running smoothly, but under very specific criteria. But, obviously, we are ready once the vaccine flows increase, hopefully March, April, May, that the vaccine flow will increase. And then again, it'll be important to get it into arms as quickly as it comes even then. But then the scale of the whole operation would be many times bigger.
We'll take a question from the phone lines.
We have Kyle Benning with Global.
Hi there. This question is for the Health Minister. Minister, you mentioned some of the logistical problems that took place up north trying to get the vaccine out to as many people as possible. Can you run us through some of those logistical problems and why they weren't addressed before the Moderna vaccine was sent up there?
Well, I wouldn't say there were logistical problems. I would say they're challenges that were, again, that's when the first run of anything is going to be the one where we work out all of the turns and bumps in the road that we have with anything that we're doing. You have to remember, we're getting these products from here in Regina that have to go up to Fond du Lac, that have to go up to Stony Rapids, that are going into the far northern reaches of our province that don't have roads, that we are making sure that planes are available to get that up there as fast as we can and then get administrated in there. And again, this isn't a very densely populated area. The population is spread out in the north, central, the northwest, and the northeast. So when we're doing that, it's not as if there's a lot of individuals that are there right now, certainly that are meeting our first order of sequence, which are long-term care residents, people that are over 50, healthcare workers. There's not the volume up there that there would be in the larger centers. So we have been planning for this. As Dr. Shahab had identified, we can do 18,000 of the flu vaccines a week, but that's when it's in very densely populated areas. When we're going up into northern communities and remote areas, it creates some challenges that we have to work out. And again, the first one is always going to be the one that works out all of the logistical concerns that we have out there. And then when the next run comes, it'll obviously be smoother and faster. People will be ready for the process.
Follow-up question, Kyle?
No, I'm good, thank you.
Thanks. Take a question in the room. Steph?
Minister, I fail to understand, you say you're getting these vaccines into people's arms as quickly as possible, but why is it okay that this province got 4,900 doses of Moderna's vaccine 9 days ago, and we've only had 48 doses done as of today? That's a very small number, and I don't see how that kind of flies in the face of saying this is happening as fast as you can do. Well,
the Moderna, again, it arrived last week. And we're getting that up into the remote communities. And again, it's not, there's a very big difference of getting the vaccine in somebody's arm and getting it in somebody's arm in a remote community that meets our first sequence of priorities. So when you start narrowing down that field each time, it gets a little bit more and more challenging to be able to get that. So when we have people that are only getting vaccinated that are in our first sequence, which is healthcare workers, as I identified, people over 50, there's not a lot of them up in the remote communities. So when we do this, we have to make sure that they're ready for the vaccine and that they want the vaccine. There's a lot of people throughout the province that are waiting to see, the vaccine. They want to make sure that it's safe, which it absolutely is. But there's only a limited amount of people up there, and that's why we prioritize the North with the recommendation from the federal government and Health Canada to be able to prioritize remote communities that don't have easy access to larger healthcare centers.
Yeah, you talk about the problems and the wanting more vaccines delivered from the federal government, but about like 70% of Saskatchewan's vaccines are still sitting in freezers. So what are you doing to get these vaccines out of the freezers as quickly as possible?
As I outlined in our first two, Saskatoon and Regina, we had to hold 50% of them back.
Ontario and Quebec didn't, so I fail to understand why we had to.
Well, that was what the federal government had laid out, and I don't know, I can't speak to what Ontario and Alberta and Quebec and other provinces are doing. This is the sequence that the federal government laid out that Dr. Shahab and his team had identified as priority areas that we wanted to get into those northern communities that didn't have access to the same health care that we enjoy here in the larger centers. So in doing that, and again, I want to emphasize that there is some challenges in getting up to those northern communities and making sure that people are ready for the vaccines.
So when will all 4,900 doses of Moderna's vaccine be used up then?
Well, and again, and Dr. Shahab can talk about this, it's not as easy as a flu vaccine, where the flu vaccine is at room temperature and it can be moved around and transported very quickly. These are two different products completely. We have one at minus 70. We have the Moderna that has to be kept at minus 20. It has to go up. It has to thaw. We have to have the people ready for that. So I can tell you that the 4,900 Moderna have been shipped out of Regina, and they're either in transport to specific locations or they're on locations getting ready to administrate to people. So it does take time to do this. This isn't a quick process, and we want to make sure that we keep the vaccines safe while they're traveling and not to rush the process of moving the vaccines around the province, because if we get a vaccine shipment that's been rushed and somehow been damaged, we've accomplished nothing.
Take a question on the phone line.
We have Mickey DeJerk with CBC.
Hey, yeah, even when we were saving half our doses, we still weren't hitting that 50% distribution rate. And at this rate, we're averaging around 200 vaccines a day. Insane. And, at this rate, it's going to take years. And we have alone 45,000 healthcare workers in this province who are part of phase 1. And in saying that, have our target dates changed at all?
I don't think our target dates have changed. We have had to continuously adjust to moving numbers on the vaccine from the federal government. We were promised at the beginning of December that we would be getting 11,000 a week of Pfizer coming to, and that just hasn't come to fruition. That's disappointing, because that's what we geared up for and that's what we were ready for. And again, as Dr. Shahab has identified, when we get larger quantities, it's easier to vaccinate more people. Right now, we are getting the people that are in long-term care facilities, which obviously creates some challenges. We're getting the healthcare workers and working around their shifts and what they need to do. And we're working into northern, very remote communities. So it's not as if there's a lineup at the General Hospital here in Regina of 1,000 people ready to get them. We're doing this sequence very prioritized on what we see is the most challenging area that we're seeing the most fatalities that are coming, that we're seeing across my desk anyways. The people that are out there that are dying from COVID, we're trying to get to them first. So we want to make sure it's done right.
You have a follow-up question, Roberta?
Yeah, I know that you're defaulting to the government and you haven't received the 11,000 doses, but we still haven't been able to distribute the doses that we have gotten from the federal government. And the federal government has stated that they've been working with the province since May on this, and that early shipment came in December, and we still are unable to even reach that 50% distribution rate. So I'm wondering, what's the problem here and what needs to change? And what's the goal that this government wants to reach in order to vaccinate as many people as quickly as possible?
Well, the one thing that needs to change immediately is the volume of vaccines coming into our province. That's the biggest challenge we have right now. And again, as I've identified, half of the first pilot program had to be held back. That was a requirement from the federal government and from the manufacturer to make sure that those two requirements were there. We could not give out every dose of Pfizer that we received in that pilot program. So when you do that, when you take that into account, plus the ones that we've shipped up north, again, the first dose that we have received in Regina and Saskatoon, they're in people's arms. We're working on the second dose. This is positive news that we're getting the second dose. We've got Moderna that is now moving up there, up into the northern communities. And when we get into the larger centers, it'll become a lot easier for us to vaccinate more people. And again, I want to make sure that it's emphasized that we're getting the vaccines into the people that we have identified in our priority sequencing. That's not mass vaccination, which is a totally different process, which we are ready for, because Dr. Shahab has identified that we can do 18,000 a week with the flu vaccines, but we're not getting anywhere close to 18,000 a week from the federal government.
Take our next question in the room. Mark?
With teachers and students heading back into the classrooms this week, does the government have a timeline for when educators will be receiving the vaccine? Are they in the plans at all?
Yeah, as we laid out with our phase 1, what our 4 priorities areas will be, and then phase 2, when we get into that, then we'll be looking at what are the next priorities in that, but maybe I'll get Dr. Shahab to touch on. But we have been getting a lot of requests from a lot of different areas saying that they would like to be the next in line. We prioritize them based on the science that Dr. Shahab and his team are able to inform us with, where we need to get these vaccines at the highest priority.
Yeah, we'll be sharing obviously more information as we move forward and as vaccine supplies increase. But again, I'll just summarize that, the National Advisory Committee on Immunization has laid out the high-risk groups for initial phase 1, and those are long-term care residents, long-term care staff, and also personal care home residents and staff. And then there are, COVID-facing healthcare providers and populations, in the far north, for example. So those are the people currently being provided vaccine, and the supplies over January and February only allow, for the most part, for those groups to be vaccinated. And of course, the aim is to complete the vaccination of these priority groups within January and February. As vaccine supplies increase March and April, then there are working groups in Saskatchewan under the Vaccine Oversight Committee that are looking at populations by age group, because age group is the easiest way to address as vaccine supplies increase. That 18 over in the community, then 75 to 79, 70 to 74, move down in 5-year age groups. That's one approach. As that starts, you also look at comorbidities. So, for example, if you're 50 and older with risk factors that put you at higher risk, for example, diabetes, heart disease, lung disease, immune suppression, will you then remain within your age group or be prioritized earlier? So just those prioritizations, those two groups, will then be, more than the vaccines we will likely receive March and April. Come May and June, then of course we may have more vaccine that beyond age groups you can look at front-facing occupations which are not healthcare, which include teachers, include other front-facing staff who have been performing essential work ever since March. Obviously, if we had, all this vaccine today, they would be in that group. But, that vaccine for eligibility for front-facing occupational groups would likely be only possible based on our current best estimates, which are not confirmed of vaccine availability. It will likely happen in May, as late as May and June. And then July, August, school-age children, adults under 40 would be able to get the vaccine. That's my broad estimate of, given what we know right now. All of that can change. We could get more vaccine, and that's welcome earlier. Vaccine supply could be constrained even going forwards, even in May, June, because there's lots of issues that can happen. None of these vaccines are manufactured in Canada, so there's lots of issues that can happen on the way, and that is exactly why we have to practice all these public health measures that we're practicing all the way at least till May, June, until the vaccination really picks up to address the broader population, and then hopefully by September we can come out of the pandemic.
Follow-up question?
Yes. Has the UK variant been found in Saskatchewan yet? And how concerned are you about the high positivity rates test positivity rates that we have been seeing over the last few weeks?
Yeah, so for the UK variant, again, on the public health side, all persons who have traveled internationally and all persons with a history of travel to the UK, they obviously have to quarantine for 2 weeks. If they become symptomatic, they are tested, and their tests are automatically screened for the UK variant, and that testing is underway. So far, we have not detected any UK variant in Saskatchewan. But then the responsibility also is on the individual. No non-essential travel outside of Saskatchewan to any other province or any other country. Strict observance with quarantine regulations when you come back. Seek testing if you're symptomatic. Declare your travel history. There have been reports in Canada and the US where people have not declared travel history to the UK and have been able to get flights through third countries. And so that then is the responsibility that all individuals have. First of all, not to travel unless absolutely essential as part of your job or for other essential purposes, and then to abide by all quarantine guidelines.
Take our next question from the phones.
We have Lisa Schick with CJME.
Hi. So you said you're going to be administering all doses now and going forward as they come in. That seems to indicate you're pretty confident that you're going to get doses in the future, going to get those shipments. But, Minister, you're also saying that doses aren't coming into the province fast enough. So how can you be sure that you're going to have enough of these second doses, that they're actually going to be here when you need them if you don't hold half back?
Well, I guess the easy answer is we're still looking for more volume from the federal government. We are. We're confident that we can get the 6,800 doses out as quickly as possible to make sure that they are getting into people's arms. We're trying to we have a set schedule for the next few weeks on Pfizer, but that number's lower than what we would like. So that's why we will do 6,800, and then when their time comes around for the second shot, then we will have hopefully that second dose available for them to be able to receive that second dose. But again, it's the volume that I'm very concerned on. It would make things a lot easier if we were getting twice the amount of vaccines that we are receiving on a weekly basis.
Follow-up question, Lisa?
Yes. I'm wondering what kind of communication there's been with care homes in the province as you get further into this plan. Long-term care homes are part of the first phase, but we've been talking to some administrators and people living in care homes who say that they have no idea when they'll get the chance to be vaccinated. They haven't been given any timeline for their home.
I'll make some comments and then ask Mr. Scott Livingstone to add. From my side, all personal care homes and long-term care facilities need to be ready with consents in place for residents, where residents give their own consent or where consents have to be obtained through next of kin. All staff should be ready to receive the vaccine. All lists of staff, when are they working, when are they not working, everything should be in place. And already, what do any of the residents have allergies to any of the vaccine components, so much staff. You can't start fiddling around with all that once the vaccine comes to the long-term care home. So that's the first thing. All of that needs to be in place today or this week. Once that is done, you have to wait for the vaccine. The supply is very limited. The supply is coming according to fixed schedules. For example, PA this week. How will it go to other long-term care facilities? There's going to be a somewhat scheduled process, but that can change very quickly. So, for example, like the minister said, if there are no shows, you can't sit on the vaccine. Once you thaw it, it has to go into arms within 5 days for Pfizer. It can only remain in the fridge for 5 days. Moderna, once it thaws from -20, it can only stay in the fridge for 30 days. It's not like the flu vaccine. We got 600,000 doses of the flu vaccine. 400,000 maybe are in arms, 200,000 sitting in fridges. It can sit in a fridge for 6 months till it expires. These vaccines are very temperamental. -70 Pfizer, -20 Moderna. Once you put them in a fridge, closed vial, 5 days for Pfizer, 30 days for Moderna. So all the other stuff has to be sorted out beforehand. And even if you have no information that you're going to get the vaccine this week, next week, 3 weeks from now, all your consent should be in place today or this week. And I think I would like really to emphasize that there is no, it is not acceptable again for staff to have to rescheduling their appointments. Staff who are being offered the vaccine because they are front-facing COVID staff, long-term care staff should have made up their mind, show up for the vaccine. There's a slight overbooking recommended so that if the staff doesn't show up for whatever reason, next in line gets the vaccine, and if you run out of vaccine for that day, for that facility, then you wait for the next allocation. But these are very complex logistics, and the long-term care, personal care homes need to be ready with all the documentation and consents and processes. And I'll ask Mr. Livingstone if you have any further comments. Scott.
Thanks, Dr. Shahab. The only thing I would add, Lisa, is that to Dr. Shahab's point, the homes need to be getting prepared now. They do this every year for our flu immunization programs, and in fact, they already are their priority for vaccinations, so getting those vaccinations out to them as quickly as possible. So the good news is, as ministers announced today, is with going with the first dose and in getting them out for everyone and not holding back second doses, that means we'll be able to vaccinate more of this priority population quicker. But they need to be prepared just like they are for the flu season. And we will not, just because of the many reasons and logistical challenges that Dr. Shahab and the Minister have outlined in detail today, we'll be getting a schedule 6 weeks out saying this is when we're coming to you. As we move forward with getting the vaccine into the cities, particularly the Pfizer vaccine, which has a very limited distribution across the province, we will be expecting the facilities to be taking accountability for identifying those residents and staff to be vaccinated, getting the consents in place, and being ready for when we come, just like they are when we do flu clinics. And this is not, other than the logistics around the vaccine itself, this is where we actually deliver the most vaccines in the province every single year, is in these facilities.
We'll take our next question on the phone.
We have Dan Jones with NBC.
Yeah, good afternoon, Minister. The Lac La Ronge Indian Band Chief, Tammy Cook-Searson, has expressed concern about the rollout of the first allotment of the Moderna vaccine, saying that she wasn't consulted and neither were local medical officers of health. So why hasn't the province been in touch last week with local leadership about how this rollout will happen?
Thanks, Dan, for the question. I had a good opportunity just before we rolled out what our priority sequence was going to be for Phase 1 to have a conversation with Chief Bobby Cameron, Chief Tammy Cook-Searson, Chief Pagan, and President Glenn McCallum on December 8th to be able to inform them of this is what our sequencing was. We were prioritizing the north. Everybody that was on the call seemed pleased that we were prioritizing our Moderna for up in the north, and that's exactly where we shipped our Moderna. As identified today, the far northeast is going to get their Moderna allocation. It's left Regina. It is on its way up there. I understand that there's some concern up in the north, but these are the first people that we've got identified, that were identified to these chiefs, these leaders up in the northern communities, and the first ones that we've got vaccine, or the Moderna vaccine, in their arms.
Follow up, Dan?
Yeah, last week, Minister, in your presentation, you said that there were 4,900 Moderna vaccines destined for the far northwest and the north central regions, and that really the far northeast was being excluded. And in today's presentation, you say as of December 28th, 1,450 approximate doses of Moderna are headed to the far northeast. What has changed from 7 days ago to today?
What has changed from 7 days ago to today with the shipment of Moderna up to the far north? We had to do a trial run for the north central and the northwest areas, and they were very remote communities. And now we're getting it into La Ronge and other areas in the north. But again, there's a couple of things that we want to identify. We want to see what is the uptake going to be in these northern communities, and then we're going to backfill on that based on our Moderna shipment that's arriving hopefully on Monday. We've got confirmation that it's arriving on Monday. So again, if those shipment of that 5,300 Moderna, we will keep backfilling up into the northern and remote communities as required. But we want to see how things go up in the north first, just because of the geographical, logistical challenges that I've already identified.
And we'll take one more on the phone line.
We have Roberta Bell with Global.
Hi, I was just wondering if we could get a response from the minister in regards to what we now know about the number of deadly COVID-19 infections that have been in long-term care homes. More than 40% of the deaths last year were among residents in long-term care homes. How does the government, I guess, think of how it's responded to that?
Well, I think we worked with our long-term care homes, the private care homes, and the ones with the government on protocol. If there is an outbreak that has been identified, we have boots on the ground immediately to help contain that. And again, this is why we've also identified as these individuals as the first priority to be able to get the vaccines. That's what's going to help them the most, other than following all of the public health guidelines. In the interim of getting the vaccine, is getting that vaccine into those individuals, and that's why we prioritized it in our first sequence. These are the first individuals that will get that, not just the people living there, but also the people that are working and taking care of them.
Do you have a follow-up question, Roberta?
Does the government feel like it did a good job navigating outbreaks in long-term care homes last year?
I would say that we've continued to work with the individuals that are managing these long-term care homes in identifying any outbreaks as soon as possible, getting in there, helping them out with the PPE, working with any individual group homes that needed extra help. We've backfilled with staff. We've pulled staff out of our healthcare system to be able to work with individuals within their homes and within the larger ones to make sure that those residents and staff are safe. And I think that the care homes have continued to evolve as we've evolved over the time of this pandemic to make sure that their residents are as safe as possible. And I don't know if Dr. Shahab or Scott wanted to add anything to that.
I'll add a couple of comments. Again, when our community transmission rates are low, long-term care homes are safer. When the community transmission rates are high, it's inevitable that unfortunately we will see devastating outbreaks in long-term care homes and primary care homes, and that's what we've seen over December and January. So again, why we need to all observe all the steps we need to keep the most vulnerable safe, including residents in long-term care, personal care homes, and also persons 70 and older in the community, because again, the risk of mortality and morbidity is highest in age group 70 and older, and in individuals in congregate living settings who are 70 and older. But then, of course, others, with comorbidities are also at high risk. So still such time that there's vaccine available for all these high-risk groups, we all have a responsibility to keep our overall community transmission numbers low. And secondly, I absolutely agree that given all these constraints of supply, the complexities of distribution, while that is the reality, it is a race against time, January and February, to get all long-term care residents, staff vaccinated. I think that is a challenge that has to be met. It's complex, but we all have to do our part to make that happen. Thank you. And Scott, if you have any comments.
I have nothing to add, Dr. Shahab.
Perfect. Thanks, everyone. That concludes today's conference.